Good afternoon. I'm Dr. Sadri, board certified ophthalmologist here in Newport Beach, California. I get this question a lot. LASIK surgery. Should I have it? Should I not have it? Does it wear off? Does it hurt? All those things. And we really haven't talked about that. It's a big topic. So here we go. So LASIK surgery is intended really for patients that are younger than 50 years old, number one. Number two, patients that are nearsighted, what we call myopes. And it doesn't mean that patients older or hyperopes or farsighted people cannot do it, but they're less of a candidate, and I'll explain to you why. Number one, when we work on laser, we work on the cornea, we don't touch the lens. So it's intended for patients who still have a normal lens that can still see near and far, but they need a correction up front. So let's face it, when you need the LASIK surgery, you need to fix the cornea. Either you do that by laser, okay, or you do it by contact lenses or glasses, right? And that patient can still see near and far. So when we do LASIK surgery, we work on the cornea, this clear part of the eye, okay? And this tends to be very stable, excellent for many, many years. But right around 45 years of age, the lens stops working. That's called presbyopia, or what we call loss of near vision. And that's why you see friends and relatives that hit 45, 50, they start needing readers. And the reason for that is because they lose their ability to focus up close. So the LASIK does essentially wear off because the lens no longer functions. And so the patient says, I was doing great. Then when I hit 45, 50, I needed reading glasses again. And the reason for that is not because the actual laser loss of function, but because the lens and the body just ages. So there's different modalities we covered on lens replacement or cataract surgery that addresses that if you're in that candidacy. So in medicine, really everything comes down to the age and candidacy. Number one, if you're young and you're myope, you might be a great candidate depending on the different parameters for LASIK surgery. If you're 50 and above, LASIK surgery is something that I would not recommend because it wears off and there's better technologies like lens replacement or what we call early cataract procedures. So you want to make sure that when you get checked, make sure you ask all the proper questions. And this is super common. That comes up in dinner parties and people ask about it. So I just want to make sure you covered it. If you have any questions, as always, make sure you subscribe and like this video and call me if you have any questions or information on our website. Thank you so much.